Jade Ramsingh is a 44-year-old male patient who was admitted to the ward with a history of colicky pain in the left flank back region and upper quadrant of the abdomen.
Good morning, Mr. Jade. How are you feeling today?
Oh, it's real pain. Oh God, it's real extreme. Oh God, it radiates into my blood and my scrotum. Oh Lord. And I even get nausea and vomiting too.
A CT scan revealed nephrolithiasis. A urinalysis revealed cloudy and offensive-smelling urine. Vital signs: temperature 38.1 degrees Celsius, pulse 88, respiration 24, and SpO2 of 98%. The medical doctor decided to do a shock wave lithotripsy to remove the stones. However, Jade is reluctant to do the procedure. As a fisherman, he is concerned that his hospitalization can impact the financial well-being of his family. Today, we'll be discussing Hildegard Peplau's theory in the management of Jade Ramsingh. Our group members are Kelly Casa, Dominic Hamilton, Marybeth Taylor, Sherelle John, Miria Goretti-Norfolk, Anisha Coleman, and myself, Lillian Hall. Our objectives: to discuss an overview of Peplau's theory, to identify the relevance and application of this theory pertaining to the case scenario, to outline a brief pathophysiology of nephrolithiasis, and to demonstrate a plan of care for the patient.
The overview of the theorist, Hildegard Peplau. She was born September 1st, 1909 in Reading, Pennsylvania. She is known as the first nursing theorist to be published after Florence Nightingale, and she was resilient in achieving more than what was expected of women at that time, right? She graduated from Pottswood Hospital School and then started her nursing career in 1931. Hildegard developed middle-age nursing theory of interpersonal connection, which helped in revolutionizing nursing scholarship, right? Her entire career was devoted to expanding Sullivan's interpersonal theory for application in nursing. She then obtained her master's doctorate and also was certified as a psychoanalyst. She created and taught the first class for graduate psychiatric nursing students in 1950. And from 1954 through 1974, Dr. Powell served as a faculty of the University College of Nursing. She then established the first graduate level program for clinical expertise in the mental nursing at Rutgers, and Powell advocated for advanced education of psychiatric nursing. She argued that nurses should offer patients with a real therapeutic care rather than the custodial treatment that was common in mental hospitals at the time. Critique of the theory. The model centers around well-being, advancement, and health in addition to the treatment of the evil above all. Peplau stresses that both patients and the medical attendants can develop from the helpful collaboration as the two of them meet in an innovative relationship where there is a procedure with a feeling of commonality and harmony. Nevertheless, the model shows a few shortcomings, since the focal point of the model is on the medical attendant-customer relationship. The customer would be needed to foster this relationship with each medical caretaker he or she interact with, which would be various. This could make a customer's visit to office care especially upsetting, as each attendant would accompany their one-of-a-kind character, perspectives, and point of view. Moreover, the model is simply versatile to nursing settings where there can be correspondence among medical attendants and patients. Definition of theory. The nurse-client interaction was stressed as the core of nursing practice in Hildegard Peplau's interpersonal relation theory. Many saw it as innovative since it stressed the give and take of nurse-client relationships. She described nurses as an interpersonal process of therapeutic contact between an individual who is ailing and is in need of health care and a nurse specifically equipped to identify, adapt to the need for care. It's an evolving factor and instructive tool that involves two or more people working together towards a common objective. Peplau coined Sylvan's relationship improvement model, as she includes his character development and self-framework theories into her work. A person is learning when she or he chooses stimuli in the environment and instead interacts with them. Concept of theory: man, health, society or environment, or nurses.
Assumptions. Interaction between the nurse and patient is possible. Peplau stressed that the therapeutic connection allows both the patient and the nurse to mature. Communication and interviewing abilities are still important nursing skills. Peplau argued that in order to assist their clients progress and to avoid limiting their options to those that nurses favor, nurses must have a clear understanding of themselves. In this section, we will look at one strength and one weakness of the theory. A strength identifies nursing duties throughout nurse-patient relations in a way that may be used in medical practice. Weakness. Despite Peplau's emphasis on nurse-client relationship as the cornerstone of nursing practice, health promotion and maintenance received less attention.
I am Kelly Casa and I will be doing relevance and application of theory. An interpersonal process of therapeutic contact between an unwell individual or an individual in need of medical attention and a nurse knowledgeable to identify and respond to the needs of the client. In this scenario, Mr. Jade is reluctant to do the shockwave lithotripsy to remove the stone. The nurse will therefore explain to Mr. Jade the procedure, pros and cons of receiving this therapy, recovery time, and post-procedure care, as well as concern the patient may have. The nurse has the knowledge to build trust with the patient and is able to reassure the patient. Mr. Jade is concerned that his hospitalization can impact the financial well-being of his family. Peplau's interpersonal relations theory gives the nurse the knowledge of how to explain and build a trustful relationship with the patient. The nurse can encourage and enlighten the patient that the procedure is a safe one and he will be able to care for his family in the future. Also explain what are some risk factors to Mr. Jade if he is rejecting the procedure. Information can be sent to Social Welfare Division within the hospital where assistance can be granted to Mr. Jade after his procedure. Therefore, all his financial concerns will be sought out immediately and he would be at ease to get his medical procedure done. Peplau's interpersonal relations theory can help build a therapeutic relationship between the nurse and the patient. So the pathophysiology of nephrolithiasis. Nephro indicates kidneys, whereas lithiasis indicates stones. So basically, nephrolithiasis is the presence of stones within the kidneys and is oftentimes referred to as kidney stones or renal calculi. There are two main factors of the formation of nephrolithiasis. The first one is stone-forming components such as calcium, oxalate, and uric acid supersaturating the urine. What basically happens is that crystals or foreign materials can serve as niddy, allowing ions from supersaturated urine to form small crystalline formation. The calcium is found in the vast majority of
the renal calculi. The majority of the remaining minority is made up of uric acid calculi and crystals with or without other contaminating ions. So now the second event that is most likely responsible for calcium oxalate stones is a deposition of stone materials in a renal papillary calcium phosphate needles, often a random plaque, which invariably comprises of calcium phosphate. So basically, the calcium phosphate accumulates in the subepithelial space of the renal papilla after precipitating in the basement membrane of the thin loop of Henle, eroding into interstitium. Then the subepithelial deposits, dubbed the Randall plaque for a long time, gradually destroys the papillary urothelium. What basically happens is that a urinary calculus is formed when stone matrix, calcium phosphate, and calcium oxalate progressively build on the substrate.
Now on to a plan of care. Firstly, an overall assessment of the patient will be done, where subjective and objective data will be recorded. Subjective data being colicky pain in the left flank, which is the back region and upper quadrant of the abdomen. Patient verbalized pain is extreme, acute and radiating to the bladder area and scrotum. Patient also verbalized experiencing nausea and vomiting. Objective data would be patient is a 44-year-old male, while CT scan showed nephrolithiasis and urinalysis, cloudy and offensive smelling urine, as well as vitals would be recorded. The diagnosis would be hypothermia related to infection as evidenced by increased body temperature above normal range, as well as cloudy and offensive smelling urine. A plan of care for this patient would be to have the patient's temperature subside while maintaining a core temperature that is within a normal range. To carry out this plan of care, interventions that would be taken would be to provide the patient with a tepid sponge bath. Reason for this being, it will reduce the fever, whilst encouraging patients to consume adequate fluid intake. This is done to prevent the patient from becoming dehydrated despite the increase in body temperature. Another intervention would be to keep the patient on bed rest in order to decrease metabolic demands. And lastly, administer antibiotic medication as prescribed, as this aids in reducing body temperature.
Evaluation. Patient temperature decreased throughout hospital stay and remained within normal range of 36.5 to 37.5 upon discharge. Conclusion. In retrospect, Peplau's interpersonal relation theory aids in building a foundation and rapport between the patient and caretaker. Due to this, the best quality of care can be administered as there is a mutual understanding between the individuals, and the likelihood of the desired outcomes has a higher chance of being attained.